Hello, everyone, and welcome to the Board of Health meeting of January 11th, 2021. Please note that this meeting is being recorded and will be available shortly hereafter for scheduled and on-demand viewing on any smartphone or tablet device. If anyone else is recording the meeting, please notify the chairman. Pursuant to Governor Baker's March 12, 2020 order suspending certain provisions of the Open Meeting Law, General Law, Chapter 30A, Section 18, and the Governor's March 15, 2020 order imposing strict limitations on the number of people that may gather in one place, this meeting of the Chatham Board of Health is being conducted via remote participation. No in-person attendance of members of the public is permitted, but every effort will be made to ensure that the public can adequately access the proceedings as provided for in the order. A reminder that persons who would like to listen to the meeting while in progress may do so by calling the phone number posted. That number is 1-508-945-4410, and the call-in ID number is 933-558-016#. Thank you, and I turn this over to the Chairman of the Board of Health, John Beckley. John, you're on mute.
Thank you, Judy. This is John Beckley. I'd like to start the meeting tonight by doing a roll call of Board of Health members to establish who's on the call. Dr. Noble Hanson, are you on the call?
Present.
Ron Broman?
Present.
Ed Sheehan?
Present.
And I'm present. Is Alan Ward, is Dr. Ward on the call? I don't think he was going to be available. Okay, so we have four. We have our quorum. I'd like to start with the first hearing tonight, which is a show cause hearing for sewer connection order involving Sean Murphy and three properties right adjacent to each other on Main Street at 1685, 1703, and 1715. All the board members received information from Diane in regard to a letter that Mr. Murphy had sent to the board. Mr. Murphy, you on the call tonight?
Yes, I'm present.
Okay.
And this is Sean Murphy as well.
Okay, good. Thank you. Judy, I have a question. When was the initial order sent for these properties to be connected?
I believe, let's see, let me go back and look. Oh, I don't have the letter in front of me.
Was it fairly recently?
No, the original orders were sent back in probably 2015.
Okay, so it was a while ago.
Yes. I don't have the original order, but I can get it while we're talking and let you know.
Okay. So
if I could just interject for one quick second on regarding that date.
yes.
So one of these properties still, so on 1715, there was supposed to be a sewer connection just out front of the building, just like 1705 and 1685. That sewer connection, the town missed it. They made a mistake. They never put it in. And we have been going back and forth with the town trying to rectify that issue. Just recently, it was established that they're going to put the sewer connection for that building down, is it Market Street, to the side. That's still an ongoing discussion with Dr. Duncanson regarding the cost difference of now our cost difference for now. Instead of going straight out the building, we now have to go out and to the left down to meet the new proposed sewer connection. So although the date may have, or these letters may have been sent out a while ago, this is still an ongoing, we're trying to, it's an ongoing discussion. Nothing's finalized just yet.
Now, is this Sean? Is this you talking, Sean Murphy?
Correct. Yep, this is Sean.
Okay, so you're saying the connections the stubs for 1705 and 1685 and 1705 were installed, but there was a delay in getting the 1715.
Well, not a delay.
Correct.
They didn't put it in. It's not in right as of today. It's not there.
And that's the one that would go over to Marketplace.
And now that's being redirected over to Marketplace.
Okay, so if you wanted to install 2 connections today, you could do it, but you couldn't do the third.
Well, the issue, we own all 3 properties, and if we're going to do it, economies of scale would make sense to do so. And therefore, the idea, a business decision, like most other businesses would probably make a similar decision. Let's do all 3 at once for a little bit of an economies of scale.
John,
let me interject something in here. This is Mr. Murphy talking. 18 George Ryder Road is also my building. And maybe 2 years ago, the septic failed. And I requested the town to put the stub in. That stub, I think, was just put in maybe 2 weeks ago. In the meantime, I had to put a septic in and pay for that septic to the tune of over $15,000. The septic for 1715, I think I've been in contact with our construction. I haven't talked to them for like 2 weeks maybe, but I think they were in the process of putting that stub in. So we were trying to get all the stubs in and get maybe a discounted rate for a contractor to connect us to the stubs. So now with COVID and people not paying the rent, it's a very, very financial difficult situation to be in.
John, could you recognize Bob Duncanson? He's got his hand raised and he may be able to add some information to this discussion.
Okay, I don't see where the hand is, but certainly, Bob, you have the floor.
Yeah, hi, John. Thank you.
Hi.
Yes, Mr. Murphy is correct that when the sewer was installed along Route 28, the town was under the impression that 1705 and 1715, while they are under the same ownership, we misunderstood that they are in fact separate lots, and so they should have had 2 separate stubs, and two separate stubs were not put in. One stub was put in front of 1705. So we said, well, one way to rectify that situation, given the fact that we were going to be working on Marketplace, was to put a stub on Marketplace that would allow 1715 to connect in, because they had already done work on Route 28. It was really just a question of timing. The West Chatham project came along. They were working on Route 28, and we didn't want to redig in that area and then, not have sufficient time for settlement with the new road going in. So we've been talking to Sean Murphy several times about this. There is a concern on their part about the cost to go over to Marketplace. So one of the options that we're looking at, because these are non-residential properties, they will be required to have a manhole at the property line. So one option we've been looking at to help reduce the cost is connect 1715 into the manhole that will be part of 1705's connection. So we have a couple of different things that we're reviewing with them. They were getting some costs from their contractors about the differential, and then we were going to get back in touch with them and have that conversation. So my recommendation at this point to you is that the board consider extending their time to connect while we work through these final details. And as Mr. Murphy alluded to, there will be a stub at 1715 off of Marketplace. If it hasn't already been installed, our is out there finishing up installations of sewer laterals, but I believe they are already done on Marketplace. So basically, we'd be looking at two options: one, a connection to Marketplace, or one, a connection through the manhole connection for 1705. You know, we can get this resolved hopefully fairly quickly now. So I would just recommend that the board continue this for a period of time.
Okay.
Well, let me just say this. This is Mr. Murphy again. In light of the coronavirus, with people struggling to pay the rent, us struggling to pay the mortgages, the property tax, the water and sewer bills, what, and I read that letter and it was like, you got to do it today. And the connections aren't completed, or maybe they were just completed. And what kind of relief do we get from waiting till these people pay the rent? I mean, it's probably 6 months down the road. They're still there. They're struggling as we are to pay the rent.
Again, to add to my father's point, you know, these are small businesses that, you know, at some period of time have been shut down. And, you know, we're small landlords. We're mom and pop landlords. So the kind of the circle of life is really been hit everybody. So, you know, we try to bend over backwards to help them. And then, you know, kind of the puck stops at us. And right now we're trying to do our best to just keep everything afloat. Never mind take on a sizable excavation project.
How much, this is John Beckley, Sean, how much time would you like to have in terms of an extension?
Well, a little bit of a loaded question. I'm still waiting for Nickerson to get back to me. As Dr. Duncanson had mentioned, we're trying to figure out that actual cost. And Nickerson has all our plans. They are reviewing them. I was told they would be back to us by now, but they're not. So it's kind of a load. It's a little bit of a loaded question. If we could take it in chunks, I think that would be better when we know more information.
But Sean, excuse me, my point is we're in the middle of the pandemic. It's getting worse instead of better. People haven't been vaccinated. These businesses are struggling and we're struggling. So, I mean, it's going to be in the fall of 2021 where we know where the lay of the land is with folks, you know?
John,
Yes,
this is
Judy.
Judy. I just wanted to let you know, the original letters were sent out in December of 2014. So we do know at that time they had 2 stubs available in December of 2014.
Well, yeah, we had 2 stubs, but as Dr. Duncanson mentioned, there's a chance we'd connect into one of those. So
Correct. I understand that. I'm just
Yeah.
letting God know when the original letters were sent out.
Well, this is John Beckley. I understand the special circumstances relating to the COVID-19 pandemic and how that causes delays in many areas of our economy, particularly rent paying. So I would be okay as a board member deferring your compliance date to 1 year from now, and that would give you enough time to get out of the pandemic timeframe, which we all hope will be gone but sometime this summer, certainly by the fall of this year, and then several months thereafter to kind of play catch up with some of your revenue streams. So I don't know what other Board of Health members, what do you all think about that?
Yeah, this is Ron Broman. What type of business are in those 2 locations?
I have a consignment furniture store, a consignment clothing store that she just went out of business and she's going out in February. She can't cut it. I have a
the shoe business.
a
rental business.
insurance company, and a lawyer.
Okay, thank you.
I mean,
Any
I would appreciate it, what you just said, if you could postpone it till a year from now, and then let's revisit it and see where we are with this pandemic, with finances, and have another meeting then, or if that's possible.
Well, I was thinking compliance by that time.
Well, it's an unknown, though. It's such an unknown with this virus and the financial income coming in. We could lose more people in between now and the summer. People are teetering.
How many vacant spaces do you have now?
Oh,
We have 2 right now.
Well, two
How many?
as a direct result of the coronavirus, and other tenants, we're continuing to work with other tenants to keep them afloat as best we can.
Yeah.
How many units up there totally do you have?
For commercial space,
8.
Yes. Well, you have residential up there also?
there are
Yep.
residential, yep.
Oh, you didn't mention that. You said just commercial.
Commercials on the ground floor.
And you have
There's
residential
4
on the
units
second
in each
floor.
building.
Well, I'm open. This is John
Jo-
Beckley. I'm open to any suggestions anybody else would like to make at this.
Yeah, John, this is Noble. Oh, I'm Mike. Yeah, John?
Yes.
Yeah, I think that in terms of what we've been doing, I think a 1-year extension for compliance is pretty reasonable within what we've been doing that I know of. I mean, the original order does go back to 2014, so
Mhm.
the pandemic doesn't explain the whole thing, but we're certainly sympathetic to the pandemic problem. And if the owner feels he can't do it, he can always come back for another show cause hearing, as I understand the process.
Right.
Well, what we intended to do is do everything together, and the stubs weren't even
Well,
available until maybe 2 weeks ago.
I understand.
So it's, that December 2014 is deceiving. We were trying to get everything done at once.
Yeah.
And with this George Ryder Road, with this new septic being put in there, I don't see how we can connect to a stub and throw the $15,000 down the drain.
Well, but I'm saying a 1-year extension. So 1 year from today. This is my opinion. I agree with John.
And then revisit it in a year
Well,
if we have a problem.
my hope was that you will be able to install the connections no later than
Well,
that
that's our
date.
hope too, but we don't know where we're going with this financial situation with the coronavirus.
Well, I would say let's assume that your goal is going to be to do the connections within the next year, and if you have a particular hardship in achieving that, you come back to the board before then.
Okay.
I think that's reasonable, thank you.
Can you recognize Bob again?
Yes, Bob?
Yeah, John, just for clarity, I just wanted to comment on the 18 George Ryder Road South property. That is under the same ownership.
Yeah.
But it does face on George Ryder Road South. We just installed sewer on that portion of George Ryder Road South. It has not been yet accepted by the town. Because they do the installation and there has to be testing and all that. So that hasn't been finished yet. But the property at 18 George Ryder would not, is not part of their discussion tonight in that, it wasn't one of the properties that was ordered to connect back in 2014. That property would be ordered to connect at some point later this year, once the town has accepted the new construction on George Ryder Road. Now, obviously, if the owner decided to do all 4 properties at the same time, for better pricing, that's their prerogative. But just to keep that property a little bit separate from the 3 that, are currently being discussed.
Fine,
Okay.
thank you.
Thank you, Bob. Well, this is John Becker. I'd like to have a motion from a board member to allow an extension for 1 year from this date, with the expectation that the 3 properties on Route 28 will be connected by then. And if they have a hardship, they could come back and present their case for an additional extension at that time.
Thank you, John.
Thank you.
Motion to approve the decision.
Okay, do we have a motion?
Ed Sheehan. Second.
Okay, we
Second,
have a
Ron Broman.
motion that I just said, right, Ed, and a second from Ron?
Correct. Yes.
Okay, any further comment from the public before I call the question? Hearing none, when I call your name, please indicate how you vote on the motion. Dr. Hanson,
Approve the motion?
Ron Broman,
Approved.
Ed Sheehan,
Approved.
and I vote to approve. So we have 4 votes to approve, 0 to against. So the motion carries. So that's going to be the plan, gentlemen.
Okay, thank you.
All right,
You're very
thank you
welcome.
very much.
Thank you very much. Have a great day. Thank you.
Okay, good.
Bye.
Bye-bye. Okay, next issue, item number 2, a variance hearing and approval for IA Technology from Eastwood Companies. And this is a vacant lot on Deer Meadow Lane in River Bay. Representing the applicant is Clark Engineering. Dave, are you on the call?
Hello, can you hear me?
Not too well. We can barely hear you.
Is that any better?
That is a little better, yes.
David Clark on behalf of Eastwood Companies. As stated, this is a vacant lot, just a hair over 20,000 square feet. Under your nitrogen loading regulations, it's allowed to have by right 2 bedrooms. Your nitrogen regulations also state that if a homeowner is willing to put in a treatment unit to deal with nutrient loading, the board may consider an extra bedroom. So we're before you this afternoon for approval of a treatment system, an innovative alternative technology system that will remove nitrogen, and as always, a 3-bedroom system with treatment introduces less nitrogen into the environment than a 2-bedroom system without treatment. I know there was a bit of a hiccup with the floor plans. I believe Judy and Susan Ledoux of Eastwood Company straightened that out. This is a singular system that has all the treatment components within the tank itself. There are no above ground components other than the control box, which will be mounted on the side of the building. The system itself meets all the requirements of Title V and local regulations. And we're here today just for discussion of the 3rd bedroom. I'd be happy to answer any question.
Any board members have questions for Mr. Clark? I have one. Dave, I see a bonus room. I'm assuming that's above the garage.
Yes, that's my understanding.
Why is that not counted as an additional bedroom? Because it's got, I see a closet, what I think is a closet. I see a bathroom.
That is because the room is open to below, so it doesn't have the area, the isolation for sleeping purposes.
John, this is Judy. We have routinely, if the railings are open and there's no doors at the top or the bottom and we have open railings, we don't count it as a bedroom, and the property will be deed restricted so that it won't be considered a bedroom officially on the deed.
So it's more than just the absence of a door, it's the open railings aspect as well.
Correct. And this is a pretty routine application as far as floor plans for Eastward. We've done this many times with them.
Okay, fair enough. Thank you.
This is Noble. So Judy, the traditional Title V septic for 2 bedrooms has more nitrogen loading than the 3-bedroom IA technology that's being proposed. Is that correct, the way I'm stating it?
Yes, that's correct. And this is also in a zone 2 of a public water supply. So it has to meet the nitrogen loading restrictions of Title V. And the system that they proposed allows for greater effluent on the property, effluent loading based on the size of the lot. So they can go up to 3 bedrooms with this septic system as proposed, which is a single air treatment system.
Okay, thank you.
Any additional questions or comments from board members? This is pretty straightforward. We do have 6 recommended conditions that Judy would suggest that the Board of Health add if we choose to approve this. Can I get a motion on the table to approve?
Mr. David Clark here. I believe there's abutters that would like to speak.
Okay. Well, let's at least get the motion first, and then we'll open it to the abutters. Thank you, Dave. Can I get a motion to approve first?
Motion to approve.
We have a motion from Ed. Do I have a second?
Noble, second.
Noble, we have a second. Okay. Additional discussion. Let me invite anybody from the public who would like to comment on this to please speak up. State your name first, too.
My name is Peter Casey. I don't know if you can hear me or if I need to be recognized.
I hear you, and I think I see you. So, yes, you have the floor.
All right. Thank you very much for the opportunity to speak. Regarding the bonus room that you've already discussed, does a homeowner or the developer need a building permit if they were to close off that room that is open to below and put a door up? Do they need any type of permitting approval to make any modifications there, which would then make that a bedroom?
I
This
defer
is
to
Judy.
Judy on that.
Yeah, they would. Theoretically, they are required to get a building permit when they make any modifications to the floor plan of a dwelling. So they would have to get a building permit, and I would review it, or whoever staff member is here that reviews them. Yes.
Okay. Is there any regulations on the number of bathrooms for this type of system to be put in? Is there a regulation on the number of bathrooms and or sinks and laundry hookups that are allowed?
No, it's purely based on number of bedrooms.
Okay. I'm just curious, is there any regulation? I know there's a regulation on the distance between the septic system and the property line. Is there a regulation on how close one septic system is in one yard to an adjacent septic system in an adjacent yard?
The septic system has to be 10 feet off the property line. I'd have to look at Title V, but it would, I think it's like 10 or 15 feet between trenches. I don't know, David Clark, if you remember what that setback is?
I think the most restrictive separation requirement are between 2 leaching beds, and the Title V has a 15-foot requirement for that.
Yeah.
So
that's not-
presumably that if our system is constructed per plan and the neighbor's septic system was constructed in conformance with the code, there would be a minimum of 20-foot separation.
Okay, so do you know, has anybody measured where the other septic systems are in the adjacent properties to make sure that everything is compliant?
That's not our responsibility.
Whose responsibility would that be?
It would be the homeowner of the adjacent property.
Our
To-
concerns are usually not how close the septic systems are to each other, but if there were any private water supply wells, then David would be responsible for noting those on the adjacent properties.
Okay, so it would be up to the existing property owners to, and help me on because I'm a little bit new on this. It would be up to the existing property owners to know where the new system is going to go in and bring it up to you to tell you that it's too close to their existing septic system?
I'd have to look into to that question. I've actually never been asked that before. It's usually not an issue, as David says, if the systems are required to be 10 feet off the property line. So if the system we're proposing here is 10 feet and the other systems are 10 feet, then you automatically have the separation. So if their systems are non-compliant, we don't have any way of knowing it unless they got a variance. So
Okay, and so the measurement, and forgive me, and the measurement of where the system is placed, is that from the leaching fields, or is that from some sort of physical piece of equipment itself, the actual, I don't know what you call the tank, or?
It's from all the components. So all the components have to be a minimum of 10 feet off of the property line. In this particular case, the leaching field is 11 feet. It's shown 11 feet off of both sidelines.
Okay, and it was very helpful to see the floor plans and the lot plans on the town website, so thank you for putting those up. Where would you put the pool on this property? Because it says that there's room for a pool in this property. Where would you place a swimming pool? And does that have any impact on it?
Swimming pool has to be 20 feet off of the leaching area. So this is a pretty tight lot. I don't know where they would put a swimming pool.
Well, the real estate listing that they have up for this property mentions that the lot is big enough for a pool, so they're marketing it that there is room for a pool. I'm curious where that pool would be placed on the property and where they have planned for it.
I can't answer that.
At this point, there's no plans for a pool, but certainly I think why they're marketing it that way, there is room for a pool. The setback requirements for a swimming pool in this location is 20 feet from the leaching area, and that's from the primary leaching area and the reserve area that's out by the street. And it has to be a minimum of 10 feet from the septic tank. And depending on when they apply for a permit for a swimming pool, the setback from the property line is either 15 feet or 25 feet.
Okay, so then, and I don't know the dimensions of the lot, so with all those provisions in place, there is room for a pool. And
yes.
Does the pool have any impact on the septic system? I mean, the water for the pool has to go somewhere. Where does that go?
Typically, it would go to a separate leaching pit. That leaching pit is required to be, I believe, 20 feet from the either leaching trench, and 10 feet, or I think 15 feet from the septic tank. So there's ample room for that also.
Okay. And on the property plans that were provided, towards the back right of the bump out at the back of the foundation level, there's almost like a diagonal line that heads back towards one property, and it looks similar to the diagonal line that heads off of, say, the left back corner of the property that points towards the septic system.
Mhm.
Can you tell me what those are? Because I don't understand what that is and
Those
what
are
it's,
retaining walls.
those are retaining walls.
Yeah.
Okay.
So this is a walkout basement dwelling.
Okay. And does the new system, the new septic system, have any impact on the lot behind, which would be downgrade from the lot on Deer Meadow? Does that have any impact?
There's a presumption that if it meets all the minimum setback requirements and is also constructed in compliance with Title V, that if all that happens, it's presumed there are no impacts.
Okay. All right. Thank you very much.
Good.
Welcome.
Anybody else want to comment before the board votes?
John
Yes?
Noble, can you just have Judy read the conditions into the record on the motion?
Yes. Good point. Before we vote, Judy, could you just read through the conditions?
Yep. So, the applicant should restrict the property to a maximum of 3 bedrooms and record the restriction on the deed. The applicant shall sign a covenant with the board agreeing to comply at such time as the town of Chatham, through its Board of Health or Board of Water and Sewer Commissioner, directs the connection of this property to the municipal sewer. The signed covenant and deed restriction shall be recorded at the Barnstable County Registry of Deeds, and copy of the executed covenant and deed shall be submitted to the Board of Health. Throughout its life, the system shall be under an operation and maintenance agreement. The O&M agreement shall be in accordance with the DEP singular certification for general use approved dated January 3rd, 2019, modified October 2nd, 2019. Total nitrogen shall be monitored and a performance standard of 19 milligrams per liter is required to be met. Effluent shall be tested quarterly for the first 2 years, then twice per year thereafter, after approval by the Board of Health or its agent. The applicant agrees to apply a minimum of 6 inches of compacted topsoil to all landscaped areas of the property. The engineer shall submit an engineered as-built plan, including as-built elevations with a written certification that the system has been installed in accordance with the approved plan and Title V. No alteration to the floor plan of the dwelling or the engineered site plan is allowed without further review by the Board of Health or its agent. This variance is granted pursuant to the State Environmental Code Title V and the Town of Chatham Subsurface Sewage Regulations, is valid for 1 year from the date of the Board of Health approval. A permit must be issued and work commenced during the 1 year period, or the variance shall expire.
Okay, thank you, Judy. We have a motion on the table. We've read the conditions. I'd like to call the question. When I call your name, please indicate how you vote on the motion. Dr. Hanson,
Approve.
Ron Broman,
Approve.
Ed Sheehan,
Approve.
and I vote to approve as well, John Beckley.
Thank you very much.
You're very welcome.
Thank you, David.
Okay, now we're to the third and final agenda item for the night, which is an update and a discussion regarding COVID-19 with Dr. Robert Duncanson, Director of Health and Natural Resources. Dr. Duncanson.
Yeah, good afternoon. Thanks, John. Can everybody hear me okay?
Yes.
All right, so quickly running through the numbers, as we always do at the beginning of these updates. Right now, on a worldwide basis, we are over 90,600,000 cases, and we have over 1.9 million deaths. In the U.S., we currently have over 22.5 million cases, and we are over 375,000 deaths. In Massachusetts, as of yesterday afternoon, we were at 432,791 cases, and that is about a 45,000 case increase since your meeting a week ago.
Wow.
As of yesterday in Massachusetts, we were at 13,151 deaths, and that's an increase of about 500 deaths since your meeting last. In Barnstable County, as of yesterday afternoon, we were at 6,454 confirmed deaths. That's an increase of 196. 6,454 cases, not deaths, cases. And that is an increase of 196 cases since the previous day, and an increase of about 746 cases since your meeting last week. Barnstable County, as of yesterday, had 276 deaths, which was up 1 from the previous day, and an increase of about 27 deaths since your meeting last week. In Chatham specifically, we are currently at 136 cases,
Confirmed.
and that has gone up 21 cases since last week. So far in the month of January 2021, we have had 28 reported cases. And to the best of our knowledge, we still have a total of 3 deaths confirmed of Chatham residents. And as I always say, there may be more that are not necessarily reported or known to us. Cape Cod Hospital, as of the last data set, had 34 patients for COVID-19 and 7 cases in the intensive care unit. Falmouth Hospital had 22 cases with 3 in intensive care. Over the weekend, we were notified of at least 7 additional cases at Liberty Commons. And I could tell you there had probably been more than that. It's just a question of when the reporting takes place as to whether or not, what particular day they show up on. But there has been a fairly substantial increase in cases at Liberty Commons or at the Broadreach assisted living facilities. And they are putting in place additional protocols and whatnot to minimize that. The majority of the cases are all in the same wing. They have, Broadreach has stepped up their testing, and they are trying to control it to the best of their ability, given that, for the first 80% of this pandemic, Liberty Commons was able to have few, if any, cases. And now they are, just like the Massachusetts, the nation, and the Cape as a whole, experience a surge in cases, after these various holiday periods, even though they've restricted visitations and frankly haven't had visitations. It just goes to show how widespread it is in the community. And as the CDC confirmed yesterday, about 55% of cases are being traced to asymptomatic carriers.
What percent, Bob?
About 55% of the cases nationwide are being tied to asymptomatic carriers.
Wow.
And then, if there's not any questions on those, I will speak to the North Chatham Post Office situation.
All right. Any questions to Dr. Bob before he?
Yeah, I just quick. Can Bob give us a quick update on what's the status of vaccines in Chatham and when they're going to be available? I guess particularly it would be the phase 2, that first section where it's over 75 and people took 2 comorbidities. Do we know anything further about, what, where, and when, and who is actually organizing all this for us?
Okay. Well, let me start with your last question first, because it's the easier one to answer. We are working with Barnstable County. It's easier to answer, but it's also not necessarily totally clear at this point. Right now, there hasn't been a substantial amount of guidance regarding what's known as phase 2. We are currently in phase 1 of the vaccine priority. And as you know, that started out with clinical healthcare workers doing direct COVID-facing care. Then we had the long-term care facilities just after Christmas. And now beginning this week, the state is moving into vaccine administration for first responders. And then there's a couple of other groups within phase 1 before we get to phase 2. Right now, phase 2 is targeted for implementation beginning in February and lasting until April. We are currently working with the Barnstable County Department of Health and the Environment, looking at regional vaccination clinics as being potentially the most effective way to get the vaccine to these various user groups. Because unlike, healthcare workers that tend to all be, say in a hospital and, your long-term care facilities, which are restricted in terms of the number of people and the number of staff, and first responders, once we get into phase 2, it opens up to a much broader percentage of the population, and people that aren't necessarily in identified spaces, if you will. And so both the state and the county, the state is looking at mass vaccination clinics at places like the Big E, Gillette Stadium, potentially Fenway Park, and other places where large numbers of people can be accommodated at one time. Similarly, here on the Cape, we are working with the county, looking at large types of public vaccination clinics, very similar to some of the larger drive-through flu clinics that have been done in the past. You probably all remember last fall, there was a large drive-through clinic at the county complex. But we're also looking at places like, as you know, we used our DPW garage for a vaccine clinic, for a flu vaccine clinic in the fall. First responders from basically Dennis all the way out to Provincetown are getting their vaccine at a drive-through clinic at the Orleans DPW. And the reason for that is partly you can accommodate a large number of people, but it's also indoors, if you will, and protected from the weather because, as you know, we're in the middle of winter here. So far, we're lucky. It's been a mild winter, but that could change at any time. So that's, at this point, we don't have a lot of details. I don't think we'll get to the point where individual towns will be holding individual kind of clinics, like we do say for the flu vaccine, just because we anticipate there will be a larger number of people that will be interested, in this COVID-19 vaccine. Also, as the board is aware, the Pfizer vaccine has very critical temperature requirements. And with the exception of Cape Cod Healthcare and hopefully Barnstable County, we don't have the specialized freezer units to maintain that vaccine at the appropriate temperatures. So again, that's another thing that has to be taken into account. The other critical item is, frankly, the availability of people qualified to give the shots. We and many other towns in the Cape make use of the VNA. And so, having every town on the Cape suddenly looking for VNA nurses to administer shots would be impossible. That's why, these regional clinics make a lot more sense. Because we can get larger numbers of people through, the temperatures can all be appropriate. We have enough staff people with, the county nurses, the VNA nurses, some of our MRC volunteers, and then using MRC volunteers and CERT team members, for directing traffic and things like that. Some of these larger clinics, just make a lot more sense logistically. In terms of exactly when that's going to start, I can't tell you at this point. The guidance is February through April. We haven't seen anything specific. It's kind of being rolled out within a couple of weeks of when these various user groups start. So, for like the first responders, the details came out starting about 2 weeks ago, and then a lot of details came out last week in terms of, the specific locations, dates, times, and setting up the online system for people to, pre-register.
Whether or not we're going to be dealing with pre-registration or anything like that for phase 2 is still unknown yet. I suspect that, just to avoid a huge number of people, and some of the things that we've seen in some of the other states like Florida, where people are camping out for 14 hours in a line to get the vaccine. I believe Massachusetts is going to try to do some sort of pre-registration. But, additional details we'll have to wait for. They are doing pre-registration for the first responders as kind of, the first test of large numbers. But again, those numbers are still relatively small compared to, the general population kind of thing. So there will be more detail on that coming out as we get closer. Does that answer your question, Noble?
Yeah, just one quick follow-up. So the clinics may be out of town, and some of the seniors may have a transportation problem. Is there, do we have resources for that?
If that becomes an issue, we will be consulting with the Council on Aging, who, as you probably know, does provide bus transportation, for grocery runs and pharmacy runs and things like that. The difficulty is, we are still in a COVID situation. So where a bus in the past may have held 8 or 10, we may not have space for 8 or 10. Those are the kind of logistic issues that, we, the county, other towns, the state, will be talking about over the next couple of weeks as these things get closer is, how are they going to deal with those kind of issues?
Okay, that's very good, Bob. That's a lot of good information. Thanks.
Bob, this is John Beckley. Do we know what type of vaccine would be expected to come to Cape Cod? Which make?
Yeah, we do not know. I do know that both the Pfizer and the Moderna vaccine are on the Cape. The first group, the healthcare workers in the hospitals, they received primarily the Pfizer vaccine. This week, where we have the first responders getting their vaccine on the Cape, my understanding is it's mostly the Moderna vaccine, vaccine. So,
okay.
Yeah, at this point, we don't know specifically. It could be that one clinic is giving out one type and a neighboring clinic or in another town may actually have a different type. So, yeah, we don't know that specifically yet.
Okay, thank you.
Bob, I have a question.
Yes.
Yeah, Ron, who's included in phase 2?
Okay, phase 2 includes individuals with 2 or more comorbidities. And it's on the CDC has a listing on their website of what those comorbidities are. And so in the first group within phase 2, it's individuals with 2 or more comorbidities and individuals 75 years in age or higher. Because the thinking is obviously they are more at risk than some other people. The next group down from them, or the next group in priority, if you will, is early education and K-12 workers, transit workers, grocery store workers, utility workers, food and agriculture workers, DPW workers, water and sewer operators, and that kind of broad group. The next priority is individuals 65 years in age and older. And then the final group in phase 2 is individuals with 1 comorbidity. I strongly urge people that have a specific interest in where they might fall to keep an eye on the state's vaccine website. They do update that every Tuesday and Thursday because some of these, I won't say groups have been moved around, but various individuals or individual classes, if you will, have been added to groups as things have moved along here. Like originally, the age 75 and older group was not included specifically, and then the CDC came out with some guidance that said, they should be, and so Massachusetts added that specific group to their priority list. So if someone has a specific concern, the state's website is the best place to keep an eye on that. We have links to both the state and the county's website up on the town website. So you can go to any of those three to get the latest updated information.
Thank you, Bob. This,
Thank you, Bob.
I see that Elaine Gibbs, your hand is up. Elaine, did you have a question for Bob on this part of his report?
Yes, I do.
Okay, go ahead.
As it relates to the phases, I assume that when the state came out with them, they had an indication of how many people they thought were in the universe for each phase. In other words, phase one, that we think we have 100,000 people in the state that need to be vaccinated. Do we know, I'm concerned that February is like 2 weeks away. Do we know how many people in phase one have actually been inoculated? Because they all need 2 shots. Are we behind? Or are we on target to finish phase one up by February?
I can't answer that question for you, Elaine. I know on the state is now putting out a weekly vaccine update, which contains information on what groups are getting the vaccine, how many people within each group have gotten it and whatnot, and that is updated on a regular basis. So I would suggest that if you have that kind of information, to go take a look at that weekly report. I'm just pulling it up right now because it does break it down by the various user groups. Right now there's been a total of 328,000 doses of vaccine shipped to Massachusetts. And it looks like, just looking quickly to see how many have been administered. Yeah, unfortunately, it doesn't look like they give a composite number here. Hang on, let me just see. Oh, and this is as of Thursday last week. The state had administered 141,000 doses. So if you assume that every one of those was a first single dose, 141,000 people have gotten 1 dose at least. They are now getting, we're now to the point where some people are starting to get their second dose. Because they were in that very first group that got it at the hospitals and all. So, but I would urge you to just take a look at the state's weekly vaccine update. It's like everything else. There's more data in there than you could ever digest. But the state is doing a very good job of keeping the public apprised as to what's going on and when vaccines here and how much is coming to each county. And how many people right now for Barnstable County. Barnstable County has received about enough vaccine to inoculate about 5.3% of the county population, which you may say, oh my God, that's low. And it is low, but there's a lot of other counties in Massachusetts that are, 2%, 2.5%, less than 2%. So, Barnstable County, I think because of the age demographic here is doing pretty good. The vaccine is getting to the county, and by county, I don't necessarily mean county government, but it's getting to the hospitals and whatnot as part of the first group and the first responders and all.
Just one other observation and concern. What phase one has changed. As you had said, these groups keep being added that are going to get inoculated in phase one, which is pushing out further 70-year-olds who only have one comorbidity, as an example. Is the state coming up with these, or is this out of the CDC? Because I have friends in Florida who are 70 and have already gotten the vaccination, and they're healthy. I mean, they have no comorbidities. I'm concerned about the low number and getting seniors vaccinated before the summer.
Yeah, I'm not aware that any groups have been added to phase one. The only change that I'm aware of, based on what we've been provided on our weekly calls or our twice weekly calls with DPH, is the addition of the age 75 and older to phase two. There have been no changes to phase one. And, you know, the reason Massachusetts had a vaccine advisory group, you know, obviously the CDC made their recommendations on how states should distribute the vaccine. Massachusetts had a vaccine advisory group as well. These recommendations are a result of that, and they tried to prioritize groups based on their potential exposure to COVID-19, their susceptibility to COVID-19, and tried to make it, you know, the healthcare workers and whatnot that are dealing with COVID patients would obviously be your first concern. You'd want to protect them. And then the people in the long-term care facilities, because as we know from last spring, you know, that was a very hard-hit population. So there was, you know, there was a lot of criteria that went into deciding at the state level how these groups, into which phase they fell. And, you know, again, all that's on the state's website if you want to read through their reports and whatnot, as to how they came up with that.
All right. Yeah, because the only concern I had was DPW workers. We probably have 200,000 of them in the state, and if they all get it before, you know, 70-year-olds, I don't understand how that could be considered essential workers or whatever you want to call them, where they're in contact with other people.
DPW workers are not ahead. They are the second priority group within phase two. The 2+ comorbidities and 75 years of age or older are the first priority group in phase two. And then you had the larger priority group, which does include DPW workers. And that was done because obviously, especially in the wintertime, if your DPW staff goes down and you have a blizzard, you know, that is problematic. So that is why people like DPW workers, water workers, sewage workers are in that group, because they need to keep that infrastructure going for the larger public.
Okay, got it. Thank you.
Bob, where do teachers go in? My daughter's a teacher and she's in a school, so.
Early education and K-12 workers are the second group within phase two.
Thank you.
Okay. If that's it for Bob's initial presentation and update on what's going on regarding COVID statistics and the current planning for mass vaccination. Let's now move ahead with Bob's report on the North Chatham Post Office cluster report.
Okay, thanks, John. So town staff were advised by several residents Friday afternoon that there was, and I'll use the term that was given to us, a rumor that there were a number of COVID positive individuals that worked at the North Chatham Post Office. We took that information, we reached out to VNA as well as the state to see if they were aware of anything going on specifically tied to the post office, because we were not, we meaning the health agent and myself and other town staff, we were not aware of anything specific tied to the post office as of Friday afternoon. So we reached out to VNA, which is, the board knows, does the contact tracing for Chatham. And we also reached out to the Community Tracing Collaborative, which is the state's overarching organization that does contact tracing for the state. Neither of them were aware of anything specific involving employees at the post office. We also reached out to the post office in North Chatham directly and spoke to individuals there. However, they were not able to provide us any definitive information. But then on Saturday, we did receive notification from the regional public health nurse, if you will, for the post office system, that there were a number of individuals positive at the North Chatham Post Office. Once we had that conversation with them and confirmed the information, We did put out the press release that went out Saturday afternoon to the website, to Channel 18, to a email list of town staff and others, as well as to the local media, bringing to the public's attention the information that we had gotten. We have since been following up with VNA as well as the CTC and the post office folks to try to get as much information as possible to understand when these cases were, who they involved, were they frontline workers at the post office, or were they back office staff, things like that, and to get a better sense of exactly what dates were involved with the positive test results. That information is still coming in. We have not gotten anything definitive from the post office in writing. Obviously, they are being very careful with information that they provide because of HIPAA requirements, just like we are whenever we have cases involving town employees or whatnot. So at this point, we don't know definitively when all the individuals were tested and what their results were, whether they were PCR or antigen. We do know that 2 of the individuals were Chatham residents, and the other 2 were non-Chatham residents, one apparently in Orleans and one apparently in Mashpee. Obviously, as the board is aware, we don't have any access to information on cases in other towns. So at this point, we've gotten the information out to the public. We urge people that were in the North Chatham post office to, obviously, just as you would whether you went to a restaurant in Chatham, had subsequent cases, whether you went to the grocery store that had cases, no different in terms of the response. People should self-monitor for any signs or symptoms, and if they feel they are potentially at risk. And remember, the definition of close contact, where your concern would be elevated, is you spend 15 minutes or more within 6 feet of somebody who's tested positive. If you don't meet that criteria, that's not to say that there isn't any chance, but your chance of contracting COVID-19 is minimal. And so we have put that information out. We've counseled folks to, if you have any concerns, to call your personal physician. There are now testing sites on the Cape, which is something, we really didn't have last spring and summer. There are testing sites at the Melody Tent in Hyannis. There's a testing site at the fairgrounds in Falmouth, as well as testing sites at a number of locations for Outer Cape Health Services, starting in Harwich and then moving out to Provincetown. And the Outer Cape Health Services do have the Binex Now antigen test available for free. But again, if folks, simply running into the post office, grabbing your mail out of a post box, and I do that once a week or so for my neighborhood association. So I'm in and out of the post office in, a minute to a minute and a half. That would not be considered a close contact. So we need to get that information out to people so they understand. So, it's the same thing as we've been saying for months, simply passing somebody along the street or whatnot, does not immediately mean you're going to come down with COVID-19, especially if you're following the normal guidance, or not normal, but the guidance that we and others from CDC all the way down have been saying for months. Wear a mask, social distance, and wash your hands and all aggressively, or use, the alcohol-based hand sanitizer, before you take your mask off and whatnot. All those things can reduce your potential exposure. And so, that's where we're currently at. We are hopefully anticipating some additional information from the post office, but we don't know when that may come in. VNA is aware they have now created a cluster in the state's reporting system for, cases that we can directly link to the North Chatham post office. And that's, everybody's aware of in terms of the VNA, the CTC, our staff and others, to keep track of anything that comes across that may look like it's related to that location. But, again, unless people really spend a lot of time in the post office, in direct proximity to these individuals, they wouldn't meet the definition of close contact, and, the chance of getting infected, while not minimal or not zero, is drastically reduced. And as I say, it's really no different than going into, a grocery store, any other store, stopping at a restaurant, or doing anything else that, that people are doing. So with that, I will try to answer any questions.
Let's
Bob,
open this.
Bob, Ron Broman.
Let's start with Board of Health members first, and then we can go to
Yeah.
the general public. So any board members have questions or comments for
Yes,
Dr. Bob?
Ron Broman.
Speak up a little bit, Ron.
Yeah, Ron Broman. Bob, have you ever been in the North Chatham Post Office?
I have.
You cannot be more than 6 feet away from anybody in there. And I go in there every single day to get our mail. And during, right during Christmas time and everything, I was in there picking up packages, and my wife has done she ordered some stuff, and I'm in there quite a bit, and I've picked up a lot of packages. And I've called my doctor, and he said he wants to know when these people were dated, when they were first dated, when it came down, whether it be before a certain date or what, because, he's watching out for me, because I do have a very blood condition that is dangerous.
Yes. Yes. The best information we have is that the individuals, or the information that's been passed to us, is that the individuals experienced symptoms and tested positive sometime last week. It doesn't look like it doesn't go all the way back into mid-December or anything, to the best of our knowledge. But again, based on the information that we've gotten from the post office and from VNA through contact tracing, with the individuals, it looked like this started last week. Now, in our press release that we put out on Saturday, we did push that back to December 28th, because at the time we didn't have, definitive information, and I wanted to err on the side of caution, and having people pay attention, self-monitor, and if they started to experience any symptoms, to reach out to their physician.
Could I ask one other stupid question of you? What would be one of the first feelings that you have? I mean, if you're coming down with something. I mean, is it a headache? I've heard it's loss of smell is one of the typical things, but I've never heard officially what it would be.
If there are a number of symptoms that people should look out for, and they include, and this is generally between 2 and 14 days after exposure, fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. It's a substantial list, but not everybody experiences every symptom. And as you can tell, a lot of those sore throat, congestion, runny nose, muscle, they mimic things like the seasonal flu. So, that unfortunately, it's that time of the year. It just makes it that much more difficult. Obviously, if you've got that new loss of taste or smell, you can pretty well be guaranteed it's COVID. It's not the flu. But, that's the list of general symptoms. There are some more specific that haven't been noticed in as many individuals.
Okay, thank you.
More Board of Health questions or comments?
Yeah, this is Noble. I think the North Chatham Post Office case, raises some issues for us. And I know that there's another business, and I think it's public, Pine Acres has had a couple of COVID cases, and they, I believe, have shut down their main office out on Main Street. But it raises in my mind whether we should do more for looking at the the businesses in Chatham as we did with the restaurants. And I'd propose, and I think the board should consider whether we should extend the order we have for restaurants reporting positive COVID employees and the other things associated with that to include businesses open to the public. And to me, I would put the post office in that category. Now, I know there's some issues about whether it's a federal entity and comes under different rules. But I think if we extended that order, it means that a business, including the post office, would have to report a positive COVID case. They would have to close down. They would have to do a thorough deep cleaning, and they would open after that. And they would have to post at the entrance the fact that they have a COVID positive patient and they're in the protocol. And that would alert the public. And I think it would help everybody. I think the difference between now and when we did the restaurant order is now we have a problem with businesses and COVID cases, and that's sort of a triggering event. So I think that's what's different. I'd be interested to hear what the other board members think about that. But that's something we can do for the future to alleviate some of the problems that this North Chatham case has shown us.
Ron Bowman, I think it's a great idea, Noel. I really do.
I guess,
Because
Noble, this is John. I guess I see a logic to that, but I also think that there is a different different epidemiological condition that drove our restaurant order, i.e., that people who are in restaurants are not wearing a mask, and they're there for a lot longer. And I thought that was, those were significant distinctions. If we consider expanding that order to workplaces, it's not, it's not quite the same risk level at all in terms of, I would expect that employees in a private workplace that are interacting with the public would all be wearing masks, I would think, during the interaction. And the public going in would also be wearing a mask. So I think we need to think it through, is my sense. I see there is a certain logic to it, but I'd like to hear more comments from public health sources.
Yeah, I think what we have, a problem that's demonstrated in the town with the post office and Pine Acres that I know of. And I think part of the problem with the North Chatham post office and all the controversy that I've learned about it is that they didn't have to report cases, I guess, or they didn't report cases. It was hard to get information. Bob said he went out there and he couldn't really get, or called them and he couldn't get information. And I don't think the order that we put on restaurants is really onerous in this time in the epidemic. I think to alert the health department, to do a deep cleaning like restaurants do, and then post. I don't think that's onerous. I think in the circumstances we have right now, where we're in an alarming surge in COVID, and I think it's a reasonable thing to do. It's obviously something that would have to go on our agenda. You'd have to put together specific language and probably pass it by the town attorney. But I think we should move ahead. And I'd also note that our next meeting is in 3 weeks, and I think kicking this down to bring up 3 weeks from now is probably not moving fast enough.
Well, I take your points. Anybody else have comments from the board?
I'd ask Dr. Duncanson if he sees problems or what he thinks about that, because there's been a lot of communication problems around this North Chatham post office cluster.
Yeah, thanks, Noble. Well, I think there's two different things at play here. Businesses in the Commonwealth are already supposed to notify us when they have a case. That is pretty well a standard requirement in the state's various guidelines that they put out, over the last couple of months about reopening businesses. That they're supposed to notify the local health department and kind of cooperate, with anything that we then ask them to do. I think the difficulty will be, and I'm not saying this is an impossible thing, but the post office is part of the federal government. I queried town council last night as to whether or not, if the board were to do exactly as you're suggesting, whether or not that would mean that the post office now had to comply, and basically town council said they're a federal entity. It's federal property. They are not necessarily bound by state or local regulations. They may be willing to go along with it. Individual postmasters or whatever may be willing to agree to follow that, but they still have to abide. They still have to be compliant with their own organization's requirements. Now, many of the things that we're talking about in terms of mask wearing and that kind of thing are required at the post office by their own employees. But we all know that, we've had instances in businesses in Chatham where we've gotten complaints from the public, not the post office, but complaints about other businesses where, the things that people should be doing are not necessarily being done. And we've had to reach out to them and remind them of that. And, as your board is well aware, in some cases, that has resulted in fines and court action. But it would be a different situation in dealing with the post office, just because they are a federal agency. And I asked town council that specific question.
Yeah, Bob, this is Noble. I would ask you, has Pine Acres notified you that they had a COVID case? And did the post office, the local post office, notify you, the Board of Health or the Health Department, that they had a positive case?
No, they did not notify us proactively.
And Pine Acres, you haven't heard from, I assume?
I have not heard from Pine Acres either.
Okay,
that
so
I'm
I mean,
aware of.
to
I don't
me,
know,
that's an
Judy-
example of.
I don't know if Judy heard anything from them.
Yeah.
No, I did not hear anything from them.
So I mean, to me, it's an example of how we need to, firm up the information that we're getting to help everybody. I mean, I'm not trying to be onerous or heavy-handed, but, and I think the post office, I think if we made an order from the Board of Health, I know there's the issue of compliance, but my presumption would be that they would go along with it. I mean, there's 4 post offices in Chatham. There's lots of people going in there. It's a big local entity. They'd be hard pressed not to go along with the wishes of the Board of Health, I would think.
And Ron Broman, I can speak on behalf of the North Chatham. Every time I go in there, who's behind the desk is wearing a mask. Every time you go in there, I mean, they're doing what they're supposed to as far as that, but still they had a problem. So, I mean, people have to stand up and report it when it happens. I don't care whether it's the post office or any other place. If they see people come in and out, they've got to let us know that they have a problem.
John, if I may, I mean, I think we have to be. I think we have to be careful in saying the post office has a problem. Right. Post office employees had cases. Members of the general public have cases.
Right.
The fact that they were wearing their masks and all, and in compliance with the governor's mask mandate and their own internal mask requirement, they were following the rules. But as we all know, and the CDC, as I said, reaffirmed this. This virus is so easily transmitted, and now we're dealing with the new variants out of England, or not out of, but first detected in England and South Africa, that are even more easily transmissible. So, short of these various places being closed down completely, anytime I or you or anyone goes into these places, we need to take the appropriate precaution. And this goes back to what I've been saying for months. If you go out of your own little internal, household bubble, you should just be assuming that anybody you come in contact with could potentially be COVID positive. And the best thing you can do is do those 3 things that you try to do to make, to minimize the potential. Now, I understand that, the North Chatham Post Office is a very small facility. It's about the size of the one that I deal with in Marston's Mills. But again, I'm in and out. You're in and out unless you're going in there and for whatever reason you're spending, 30, 40 minutes, which I can't understand necessarily why anybody would. You're doing the appropriate things to try to reduce your potential for exposure, but you can never reduce it to 0. And we all just need to recognize that.
This is Noble again. Well, we can't actually vote on this tonight. I don't think it has to be an agenda item. So I would say, or move or whatever, that we make this discussion of this proposal an agenda item for a future meeting. I think waiting 3 weeks to bring it up is too much, and I would ask or say that we have this as an agenda item for an emergency session of the board. That would be, end of the week or maybe next Monday, so that we can discuss this particular item, and maybe you'd have a chance to get more information to the board members. And I'd be interested to hear what John says about that.
Well, it wouldn't hurt to take a closer look at it, Noble.
And put it on as an agenda, item, and have an emergency meeting, because I don't think we can wait 3 weeks in the way this epidemic is going.
I would be open to it as a way to keep a placeholder for us to take action on it if we decide we want to. And it makes sense, if that's the case, that we do it sooner than later.
Yeah,
So,
we can. The date of the next meeting doesn't have to be determined now, but I'm thinking the latest would be another meeting next Monday with it on the agenda, and then we can just
next Monday's a holiday. Okay. That's why you didn't have a meeting next week.
Right. Okay.
But, we need 48 hours. We need 48 hours to post a meeting. So, we could potentially post something for later this week, or, for next week, any day other than Monday. That's available.
I mean, you could put, there could be some sort of proposed wording, or some, maybe more information from the town attorney, and we could work out the exact date, over the next couple of days.
Well, I'm assuming, Noble and John, your forbearance for a second. I'm assuming that what you're talking about is simply taking the existing Board of Health emergency order that you passed back in October, and modifying that to include a broader coverage, because right now it's specific to food service establishments. And it would be relatively easy, quite honestly, to just broaden that to cover, any business open to the public in Chatham.
Correct. That's what I'm thinking.
So what we could do is we could produce a red line of that, run that by town council, so you'd have his input when you go to discuss it. And then distribute that out to the board, and post a meeting for later this week or midweek next week.
Yeah, and to me, the information for the town attorney is that now we have a couple of triggering events for businesses in town that are creating issues, and so that's why we're moving ahead. It's not just in the dark, heavy-handed thing. We have some specific problems. So I agree with what you just said.
well, how would we word that, though? I mean, if I go to insurance company downtown on Main Street, and I ring their bell and I want to go in and talk to somebody, is that open to the public? Or are we talking about retail sales?
Well, we may have to hash that out, but I'm thinking that if it's open to the business where people can walk in and out, that's probably what I'm thinking. If it's by appointment, that's probably a different category. Just as a preliminary thought.
Mm-hmm.
Like an insurance building, you can just walk in there to their place. I've done that several times.
That's, we have to make sure that the reach, if we do this, that the reach is where we want it to be. Are we really thinking about retail outlets where the customers are in and out and browsing?
I would be, a clothing store, a hardware store. Yeah, and I fall back. I don't think it's terribly onerous if we are asking a business owner if they have a COVID positive employee to report it to the health department and to do a deep clean, which they should do anyway. I don't think that's an onerous extra thing to ask of them.
Right. Okay.
But I'd say the next step would be figure out, put it on an agenda, have an emergency meeting, and then just for this, and we can talk, we can hash it out, and I'm sure lots of people will have information and opinions for us.
Okay. What do other board members think?
Well, I'm in favor of it, Ron Broman.
Ed, would you be okay with calling a special meeting and discussing this as an idea? Well, I would just say don't do it Friday of this week. I would say on Tuesday of next week would make the most sense to me, but.
That sounds fine.
Tuesday's fine with me.
Same here, Ed Sheehan.
Okay, there's Ed, yeah.
Okay, good. All right, Judy and Bob, is that okay from your perspective? You can make this happen?
Sure, yeah, we'll work up some language, as Bob said, and then we'll be in touch with the board members and work out a date and time.
Okay.
It would either be Thursday or Tuesday next week, Tuesday or Wednesday next week.
Okay.
Yeah, the only thing we have to be careful with Tuesday is not to go too late because, Board of Selectmen meetings start at 6. So, maybe we do like today and start a 3 o'clock meeting instead of waiting until, 4.
Okay. I do want to afford anybody from the public who wishes to comment or have input on the discussion about the North Chatham Post Office, or to weigh in their opinion about this idea that Dr. Hansen has brought up for our board to consider. So with that, anybody from the public that's on the call wish to comment?
Mr. Chairman, I'm Gloria Freeman,
Okay.
and I'm on the telephone, and
Okay.
I would like to talk with you.
Okay.
May I go ahead?
Yes, you may. Absolutely.
Thank you. And good afternoon, everyone. I'm Gloria Freeman, and I use the North Chatham Post Office every day but Sunday. The week before Christmas and the week after, I had business to conduct in the service area every day. I want to make it clear that I do not blame Chatham's health department for the failure of information about the COVID cluster at the North Chatham Post Office. Obviously, there is a system failure, but I believe that there are steps that can be taken to provide a better system, at least in Chatham, and I'm going to make 2 such suggestions. When I initially reported the rumor that there was a 5-person COVID cluster at the North Chatham Post Office and asked that it be investigated, I specifically and in writing ask that the Board of Health members be notified immediately. You should have been advised right away because, as you know, the rumor was true. I was quite sure it was credible and provided information to support that. Every effort should have been made to inform the entire community because any of us who use the North Chatham Post Office should be monitoring for symptoms, contacting our health providers, and considering being tested. A robocall should have gone out and still should go out as soon as possible. Many people still do not know about this problem and that they were possibly exposed. I ask you, members of our Board of Health, to advise town officials that you want to know about reports so that action can be taken sooner rather than later, especially when citizens provide documentation that confirms suspicions. Considerably more than 48 hours passed between when our health agent heard about a pretty credible rumor with some supporting facts and when you, the Board of Health, learned about it. I provided many details of my observations at the post office. And remember, a Chatham resident postal worker was provided a positive COVID test on December 28th or sooner, and that a private citizen called our health department on January 4th or 5th and reported this event. If the workload is too much at this time in our health division, after all, they are having to handle an unprecedented epidemic. Perhaps others who have expertise and experience in health issues would be willing to volunteer just as you do, and thank you, to help investigate incidences that put Chatham's people at risk. I would also ask that even at this late time, you authorize a robocall so that all citizens are aware of the COVID cluster and can self-monitor and take needed steps to protect their health and safety. Will you do that? As I stated in my letter to you, citizens who make credible reports should be thanked, not criticized. We are all in this together, and again, I thank you for giving your time and effort to protect us. I certainly support Dr. Hansen's suggestion to extend your emergency order, and thank you for letting me speak with you.
You're very welcome, Gloria.
Elaine Gibbs?
Go ahead, Elaine.
Thank you. I had one question first, and then I wanted to make my comments. Bob, at the beginning, you said that you didn't have anything, hear anything specific tied to the post office. Was the first time you heard about that when I wrote my letter on my email to Judith at 12:30 on Friday, or had you heard rumors before? Is Bob there?
Sorry, I was on mute. The first time that I became aware of it was on Friday afternoon.
When I sent the first email, it was at 12:37.
Yes.
Okay. I think there are several issues we have to deal with. My understanding, I think it's really important that the postal employees, every business should report to the health department. But the first line of information is not that. It is hearing about it after it's been tested through the state. My understanding of that process is people go in and get tested. They have to give their address and their name, and then it goes into the Maven system or whatever you want to call it. And that information is reported to the town and it's reported to the VNA. That triggers the VNA to take that data and call those people and to ask them, confirm their name, confirm their address, and to ask them where they work. And once they find out that they're where they work, Then they do, as well as in their personal life, they do contact tracing, asking about close contacts. Now, we had 2 people in Chatham tested positive. Immediately, the VNA should have recognized that that was a cluster, notified the town. It has been 13 days from the time, from December 28th, and the first positive test, I believe, was either 28th or January 2nd, before we even knew about it. The failure in, I think the first issue is there was a breakdown in the protocol, that there was a failure with the VNA, and I think we would want to get to the bottom of that. That is not acceptable. For 13 days, people walked in and out of that post office, many elderly. And I went in there one day and I was in line for 15 minutes waiting to get to the window. And we were not 6 feet apart. There were 3 people in the vestibule and I was at the door. And all of the employees contracted COVID and they wore masks. So to say that unless people were in there for 15 minutes, I don't believe that. I think that people were in jeopardy. And so that's issue number 1, that I think we've got to get to the bottom of why the VNA failed. We contracted them. If they can't do their job, we need to find another contractor who gets on it, calls people and collects the right kind of data, and then notifies us as quickly as possible. The second thing in the short term, I absolutely agree with Gloria. It's essential that there's a robocall. We cannot rely on the fact that particularly seniors, they all are computer savvy, or that they listen to WXTK, or that they know how to go to the Barnstable County link. I had asked on Saturday, and I asked again today, and apparently it's not going to be done unless you guys authorize it, that robocalls go out. It's already set up. It's a no-brainer. And to give 3 pieces of data, that there was this incident, that the date, anybody who was there, to at least December 28th, I think it could have been earlier than that, because there have been no employees apparently in the post office for the whole week. So I think whatever happened well before that. Secondly, to tell them the phone numbers of where they can call so that they can go and get tested. And if we don't do that, I think it's being irresponsible. That, again, people may have missed it. I've contacted friends of mine that use that post office and they didn't know about it. And moving forward, I don't like deferring to town council on this. He's always going to go on the side of caution, but that's not necessarily what's good for people. I provided information where there is no question that the U.S. Postal Service does, in fact, require following the CDC guidelines. And the CDC guidelines say that the Postal Service has to follow it. And I also provided information showing that Framingham actually closed down their local Board of Health because they weren't following the COVID regulations. So I have no question in my mind that you are on legal firm ground to expand your order for all public buildings. And that would include banks where people are standing in line. Any person, I would say you could say after one case, if there's more than one case, they absolutely have to do that and they have to post it on their doors. I really don't like deferring to the legal department on this. There's too much at stake. And I am very concerned that people, because they didn't know, they may have been with family over New Year's, they have to contact their family members. We know how quickly this can spread. I mean, literally hundreds of people have gone through that post office and they may not know that they are a silent carrier. So I would hope that in the short term, you do the robocall. In the long term, you change that order. And in the future, I would also say that from now on, when the public comes forward with information, people aren't just going to call you unless they pretty much vetted it. We had vetted it. We were very confident it was true, and we were met with resistance. And if we hadn't pushed back, we still wouldn't know it. And the public is a very valuable tool for getting data. People do hear things, and we should be able to bring that to you and get a response. And I was also distressed that I had asked several times that my letter go to the Board of Health, because you were the guys that are going to bear the responsibility. And if you're not allowed to participate and have the full story, that's very hard for you to do your jobs. And I also recommended if You can have as much authority as you want. You are an autonomous group with tremendous power if need be, and I would urge you to use it until we get through the winter. Thank you very much.
Thank you, Elaine. I mean, just for the good of the order, I have to make a comment that we have got to end our call today in probably 10 minutes, 9 minutes by 4:55. So with that said, we do have a recommendation that the town do a robocall. I guess what's going through my mind is Dr. Duncanson did put out a media release on this on Saturday. Bob and Judy, has your release been publicized through the media?
I know it's been on the Cape Cod Chronicle, and I believe it's also been in the Cape Cod Times.
Okay.
John, as you know, we do have a robocall verbiage drafted.
Mm-hmm.
If the board would like, we can arrange to get that out tonight.
Okay. I'm okay with doing that. It may be to some degree redundant, but it may reach people that are not reached normally by the mass media. So what do other Board of Health members think?
Ron Bowman, I think it can't hurt. If we save one person, it's worth it.
Okay.
Yeah, this is Noble. I would say go ahead and do it. It can only help.
All right. So I don't know. Does we have to do a motion, or we can by acclamation authorize or request that Bob proceed?
I think, yeah, it's fine for you just to authorize it, I believe. Is that true, Bob?
Yeah, I was going to say, I have the sense of the board. We'll work to get it out.
I think that'd be great, and that would be an enhancement. Absolutely. Okay. We have to also approve some minutes here tonight.
John?
Yes.
Yeah, just one thing before you finish this topic. I think it's important for the community to know that there was no delay in acting on this information when it was brought to our attention. We first became aware of this through some citizen comments on Friday and immediately started to pursue it to the point till we got some confirmation, which we did on Saturday, and then the press release went out. And, it really disturbed me to hear some insinuations or implications that we somehow delayed this. I'm now hearing that people think that testing was done, right after Christmas and in early December. That's not consistent with the information that we have through the state system. So, it's fine for people to surmise and hearsay and whatnot. We can only, we act on the good information that VNA collects or the state collects that they inform us about. And I've said this before for many months now, the information is only as good as the information that people give when they talk to the contact tracers or to us. If they don't want to give us all the information or they don't give it to us correctly, we're not clairvoyant. We can't ferret those things out of thin air. So as soon as we were informed of this, we acted on it. And that's the way it's been for all the cases that have occurred in Chatham so far. Thank you.
Mr. Chairman, I'd like to make one more statement, please, because that was directed at me. You guys.
Be brief, please.
I will. You guys all have the sequence of events. I wrote my letter on 12/37 and at 12/37 on Friday, and I was told there was no jurisdiction. They had heard nothing was going to be done. Then I got a copy of a letter that wasn't supposed to come to me, and I wrote back that night at 8:30 and said, this is what you need to do. So there was a delay because they didn't believe that there was any legitimacy to it, which has turned out to be true. Now, we have other information that there are actually 5 people And we have some pretty good information that the first positive test was at least on January 2nd. So if you go back a week, it's at least December 28th. It could be earlier. I don't want to debate who did what when, but I also don't want to be made to say that I'm not telling the truth. This has been I've spent 3 full days working on this, and I'm a little annoyed that somehow I'm going to be the scapegoat. And we're not getting to the issue that the VNA screwed up. And that is what this board has to take into consideration. We have to find out why we were not notified. I understand the Board of Health didn't know it until Friday, but why didn't they? It's because the VNA messed up. And we got to find out why. That's where all the problems come, because nobody can contact their family members and seek treatment. So that's all I have to say.
John,
John, if I may, the VNA did not screw up.
thank you, Bob.
The VNA cannot act until we're made or they are made aware of information. In this case, we were not made aware of. The VNA was not made aware of. There was no information in the state system. One of the things that we haven't touched on here is one of the difficulties from day one of this whole situation, and I'm not talking about the North Chatham Post Office, I'm talking about COVID, has been the delay in testing. One of the issues is people go and get a test. It may be 3 or 4 days or 5 days or even 7 days, earlier. It's a little bit better now before they get a test result back. And that test result is then entered into the system, which then triggers notification to us and the VNA. There's at least one of the cases that we're dealing with the North Chatham Post Office where the test result is still not in the system. So nobody can act necessarily on information until there's something to act on. And I'm not picking on anybody. I'm not, disparaging anybody. That's just the reality. I mean, we all wish it was, you go get a test and 5 minutes later it's in the system. But unfortunately, it's not working that way. And it's frustrating for the public. It's frustrating for the people taking the test. It's frustrating for us. It's frustrating for the VNA. So everybody has been working, doing their due diligence as soon as we are aware that there is an issue or a positive test result. Thank you.
All right, thank you, Bob.
We'll defer this till next week because I've got more to say.
Okay. As for tonight now, I would ask Judy that we carry the meeting the minutes approval to the next meeting, to our emergency meeting, if we can do that, to get.
That's fine. Diane will make note of that for the next meeting.
And then I'd like to have a motion to adjourn for right now. From a board member.
Motion to adjourn, Ed Sheehan.
We have a second.
Noble.
Okay. When I call your name, please indicate how you vote on the motion to adjourn. Dr. Hanson?
Approve, adjourn.
Ron Broman?
Approve.
Ed Sheehan?
Approve.
And I vote to approve. So the meeting tonight, thank you everyone for your attention and your input. We're adjourning for tonight, and we will be reconvening next week for the emergency meeting as discussed previously. Thank you, everyone. Good night.